very important speaker of this inaugural, Dr. D.K. Singh, Director, AIIMS Bathinda. Uh, Dr. Singh, your thoughts on this particular topic of how technology is playing a very important role for public health landscape improvement, especially beyond the pandemic and the way forward. Your thoughts on that?
Good morning to all of you. I'm thankful to the organizer for inviting me to speak on this important topic, which is very relevant to the practice of the medicine. The topic is they have given me how technology is playing vital roles in improving the public health landscape, especially beyond pandemic, the way forward. We were knowing the science and art of medicine. This pandemic has totally changed the art of medicine because we are believing that if you can talk to the patient face to face, can touch the patient, can examine the patient physically, then only we can come to conclusion of a rightful uh, like a diagnosis of the patient and treatment of the patient, even satisfaction to the patient. But this pandemic has caused many things, and we have learned a lot from the this pandemic. So I will be talking on few heads, what is the journey towards the digital revolution? Because we all know that the digital revolution has transformed many aspects of the medicine. There is increasing access to the technology worldwide. The Digital India initiative made the internet easily accessible for a large segment of the population. By 2019, 67% of the global population had subscribed to the mobile services, of which 65% had the smartphone. Digital technologies have received huge boost during the pandemic. Many aspects of our day-to-day living saw digital transformation when physical meeting was no longer an acceptable norms. Travel and social restriction increased our reliances on the modern technology platform. The country, which was already on a drive for digital money transaction, showed one of the highest volume of the digital transaction in the world when the pandemic struck. Coming to the technology and public health, humanity has grown even faster than the every major changes in the world. The pandemic caught us unaware and presented unique socio-political situation, which pandemic caught was never out of the box. It broke in a way our progress. Digital platform was being harnessed to support the public health response to COVID-19. The pandemic could open the door of new technology in the medical treatment and training. We all experienced burst of the digital technology in our daily life during this time. For instance, using the WhatsApp group for information on local vendor and supply of the food items for step forwarding the epidemiological surveillance, rapid case identification, interruption of the community transmission, public communication, and clinical care. Integrated Digital Surveillance Project (IDSP) was launched by Ministry of Health and Family Welfare as a disease surveillance system for endemic-prone disease to monitor the disease trend and to detect the response of the outbreak in early rising phase through the Trend Rapid Response Team. Information and technology is no longer an integral part of the program and played a powerful role in implementing IDSP across the country. One of the important components of the program is data management, analysis, and rapid communication in case of outbreak. Digital surveillance systems were used for tracking infection cases, loads as the number of the patient were overwhelming the health facilities available. Many states developed a centralized bed allocation system to streamline the process of testing, triaging, transfer, and treatment of the COVID positive cases. Integration of the medical record and hospital information data across various public hospitals in India is needed to be better chain of the referral of the patient care. There are several lessons to be learned regarding use of information and technology around the world during and the following this pandemic. Was technology infrastructure quickly looked action, deploying the tools for information, access and dissemination, population tracking, and contact tracing across the daily necessities, and many more. Drones were also used to patrol the public space and to track non-compliance of the quarantine orders. Many nations have also used to spray the disinfectant and make the public announcement during the pandemic. Online pharmaceutics have also received a boom in this period. People were unable to go to out of the shop to buy the medicine during their this period. They got their medicine by using the technology. Our challenges have grown faster than we have ever been able to grow infrastructure to address them. India is amongst the lower investor in the health quality. The government allocate only 1.3 of the GDP up to the health. Much of the government spend has been focused on the communicable disease as well as the maternal and child health. COVID-19 pandemic made the government of India to take the cognizance of this fragile healthcare infrastructure. Coming to the education portion during this pandemic, medical education. Because of the COVID-19, millions of the students are studying at homes. Even medical students, doctors in postgraduate training, and researchers did not even enough to access to the conventional mode of the teaching. Most teaching hospitals yielded under the burden of the COVID-19 infected patient, and all over the other routines and emergency work took back seat. This had a significant negative impact on the training of the healthcare in various fields. Today, educators are compelled to consider the most effective way to teach students at home. Virtual classrooms are increasingly used not only in the schools but also in the medical colleges. Since live access to the patient, dissection halls and laboratories is not available, the task of teaching more technology intensive. In this period, we have also used this technology for international collaborations. International cooperation in science, technology, and innovation can fast track the sustainable development after the COVID-19. Collaborative arrangement of open science, especially in the mapping of the virus genomes, help the development of the COVID-19 vaccine being administered in the various countries. Sharing information has become the easier with technology, and important of collaborative efforts and information sharing have been understood by many nations during this time. Quick development and availability of the vaccine for this coronavirus is a wonderful example of information sharing. Coming to the digital initiatives, Arogya Setu, we all know about this Arogya Setu app and is an COVID-19 contact tracing, syndromic mapping, and self-assessment digital service primarily as a mobile app developed by National Informatics Center under the Ministry of Electronic and Information Technology. The app reached more than 100 millions installed in 40 days. The World Health Organization lauded the Arogya Setu mobile's application for helping health department to identify COVID-19 clusters. Arogya Setu app also alerted its user when they were within the 6 feet of a person infected with the coronavirus, provided the latest infection status is updated on app. Teleconsultation. This was the new area which has developed very fast in this COVID period. Online consultation with the healthcare providers has shown an unprecedented boost during this period. The Ministry of Health and Family Welfare launched a new portal through which the people were able to take teleconsultation services and have proper coverage of their health. E-Sanjeevani OPD, browser-based application facilities for doctor to doctor, patient to doctor telemed consultation. This was very simple and user-friendly platform. Anyone having a smartphone and internet connection could access doctor for consultation directly. Many other public and private sector hospitals developed their own system of providing consultation and follow-up their patient electronically. The Ministry of Health and Family Welfare has issued a telemedicine practice guideline allowing the patient to consult the certified medical professional without stepping out of the house. Though different forms of teleconsultation have been prevalent in the country before this, these guidelines provide a first well-defined legal framework of the telehealth. Various digital platforms were used to disseminate the information on prevention of the spread and pandemic and various facts and myths related to the infection. Digital media was also platform for the health-related information on disease, which has taken a backseat in the hospital setting, such a chronic disease and mental illness. The central government has introduced an application named as CoWIN, CoWIN for the COVID vaccination process. The registration of the beneficiaries of the vaccination and the entire database of the vaccination is being maintained online. My government app, launched by the government, was pivotal in sharing all relevant information regarding the COVID infection and vaccination. Latest regulation by the government data on COVID infection. So some of the other things like avoiding unintended consequences. Digital technology in the health can generate several unplanned risks with implementation of the reliances of the social, cultural, and political institution. These needs to be tempered and controlled as far as possible. For example, infodemics, the outburst and the inaccurate health information online can make it difficult to access trustworthy and reliable guidance on COVID-19 pandemics. False information created an unnecessary panic in the society. This led to government to declare that FIR can be lodged for this false information and will be registered against those who involved in spreading the rumors, and strict action will be taken under the provision of Management Act. The use of surveillance technology by government raises a number of pressing ethical concerns. In public health context COVID-19, the concern related especially to the potential conflict between biosecurity on the one hand and individual privacy and autonomy on the other. The initial time diagnosis of COVID-19 infection was associated with considerable social stigma. Instead of help, many patients faced extreme outcast by neighbors, colleagues, and near and dears. So the recovery will be by the digital only. The future of public health is likely to be increasingly digital. So much could be achieved in so little time. Looking back, it's time to ponder whether it was time waste or a time utilized. Could we realize our potential to grow? I would like to conclude the famous line in English literature by Lord Alfred Tennyson: "It all experience in arch where thou glimpse and that untraveled word whose margin fades forever and forever when I move. How dull it is to pause, to make an end, to rust unburnished, not to sign in use as though to breathe where life means we need to see and we need to develop and we need to learn from this COVID pandemic and the use of this electronic media and telemedicine and many other things which has come during this period. Thank you very much. I wish all success of this meeting, and I hope that there will be certain guidelines, certain new findings will be generated by after listening the speakers. Thank you very much.
Thank you so much. Thank you so much, Dr. DK Singh, Director AIIMS Bathinda, for joining us in the inaugural of 3-day APAC HealthTech Innovation Conclave. You have already explained a lot of aspects of technology innovation for the healthcare ecosystem. With this, we come to the end of the inaugural of HealthTech Innovation Conclave organized by APAC News Network and supported by Dell Technologies, Microsoft as presenting partner, gold partner, Ognitor, and associate partners, Doxiva and Vivio.